All right. Welcome to our webinar conversation. Hope, a community town hall on the COVID-19 vaccine. We really appreciate you joining all of us in these unprecedented times. We are going to do a little bit of housekeeping and jump right into it. We are so pleased to be joined by so many of you across the state, and particularly by our very special guest, Mr. Dr. Richard Watkins. But I will go ahead and fire up our slideshow and get going here. Just give me a second. So, as I mentioned before, we'll do a little bit of housekeeping. I'll start things off with some introductory remarks, and then we'll get right into it, a conversation about the COVID-19 vaccine with Dr. Richard Watkins, a microbiologist and immunologist. Then we'll go into Q&A, and we really encourage you to ask as many questions as possible. And then we'll close it out with closing remarks. Now, we had an overload of questions coming in, so we won't be accepting live questions, but we really want you to email your questions to healthactionnc@gmail.com. Again, we were overloaded, so we really want to get to your questions. We want to answer as many of your questions as possible. So please email those questions to healthactionnc@gmail.com, and that email address will be dropped in the chat. We'll be scheduling a follow-up webinar on the distribution of the vaccine. We know there's a lot of questions about the availability, where to get it, how to ask for appointments, and all those other really important questions. So as we move through this season, we will be having more webinars coming up, and so we really want you to stay tuned, and we look forward to seeing you on future occasions as well. So we wanted to be sure to let you know that there is Spanish language interpretation. And at this point, I'm going to actually turn it over to our Spanish language interpreter so they can provide some directions. All right.
Thank you, Mr. William. Hi, everyone. My name is Erwin Madrid, and my co-interpreter is Abraham Martinez. The organizers of today's event have made the commitment to creating a multilingual space. To that end, we will have interpretation from English into Spanish, and the event will be held bilingually on the Spanish channel. We ask that participants speak slowly, loud, and clearly into their microphones to make the interpretation easier. In a few moments, we will activate the interpretation for this event. If you are using the Zoom application, you will see a globe icon at the bottom of your screen. To listen to the interpretation, click on the globe and select Spanish. If you have any problems doing so, please comment in the chat box. Muy buenas noches a todos. Mi nombre es Irvin Madrid y mi cointérprete se llama Abraham Martínez. Los organizadores del evento de hoy tienen la firme determinación de crear un espacio multilingüe y con ese fin contamos con interpretación disponible en español. El evento se realizará de forma bilingüe por el canal de español en Zoom. Les pedimos a todos los participantes que hablen despacio, en voz alta y claramente en sus micrófonos para facilitar la interpretación. Dentro de unos momentos, activaremos la interpretación para que este evento, y si usted está usando la aplicación de Zoom, podrá ver un icono de un mundo en la parte de abajo de su pantalla. Haga un clic en el mundo para escuchar la interpretación y seleccione inglés o español. Si tiene algún problema al respecto, por favor escriba un comentario en el chat. Thank you, Mr. William.
Thank you so much. And we want to go through a couple of introductions here. First of all, we at the North Carolina Justice Center are very proud to be one of the state's preeminent voices for economic and social justice. We, as a progressive research and advocacy organization, we're really committed to eliminating poverty in North Carolina by ensuring that every household in the state has access to the resources and fair treatment it needs to achieve economic security. And I am very pleased to be able to serve along my wonderful colleagues, Nicole Dozier, the director of the Health Advocacy Project, Hun Nan Kung, our policy advocate, Rebecca Cerise, our health engagement coordinator, and they tolerate me, so I'm super happy to be here as a policy analyst. And we also want to give a shout out to our co-sponsors, the Carrboro Chapel Hill NAACP, the Health Action NC, and Carolina Jews for Justice. And so before we get into the conversation tonight with Dr. Watkins, again, I want to leave as much conversation, much time for the conversation with Dr. Watkins. I want to give some introductory remarks. There are really numerous reasons people of color, particularly African Americans, should be distrustful of medical research in the United States. And there's none more infamous than the Tuskegee syphilis experiment, where for over 40 years, black men in Alabama were deceived into taking part in a study where they were denied care for the disease, although penicillin was found to be an effective treatment. And so black men suffered and died unnecessarily, and we must acknowledge this history and use it for context setting. We can't ignore it, and we recognize its effect on the collective consciousness of people of color in the United States. And that said, we are in a very different context today. We invite you to listen and ask questions of Dr. Richard Watkins. 27,000 people have died from COVID-19 in the first 10 days of this year in the United States. We need every tool in our arsenal to beat this disease, to include this vaccine. And so the purpose of this webinar tonight is to ensure that you have the best information to make the best decision on behalf of you and your family. So I want to introduce our special guest, our special speaker tonight, Dr. Watkins. Dr. Watkins earned his Ph.D. from the University of North Carolina at Chapel Hill in 2014 in microbiology and immunology, with a specialty in virology. Sorry. His research focused on the factors that influence disease progression towards AIDS and HIV-infected patients. Prior to attending UNC, Dr. Watkins earned a BS in psychology with a minor in sociology from the wonderful university, Fayetteville State University, in 2007. Richard is the founder and CEO of the Science Policy Action Network, SPAN, which focuses on enhancing science education, advocacy, and outreach for the benefit of North Carolinians. He also leads the Chancellor's Science Scholars Program at UNC-Chapel Hill, where he develops STEM diversity initiatives to directly impact the next generation of leaders in science and technology. Richard is also a member of Sigma Xi. Members of Sigma Xi elect other members on the basis of their research achievements. And so with that, I would like to turn it over to Dr. Watkins. Just ask me when you'd like for me to advance the slide.
You can go ahead and advance the slide now. Thank you so much for that very kind introduction. And, you know, it is a privilege, an honor to serve you. And it's one that I take very seriously. SPAN is focused on three things specifically, and that's improving, extending, and saving life. Could you go ahead and advance the slide?
Sure.
So I want to start off here because I thought this was very interesting. And all of this stuff in which I am going to discuss, feel free to look it up yourself. I will make sure that these resources are available to you. But let's start here with the Department of Veterans Affairs. They put together a very amazing report in which they go into detail on all of America's wars, starting in 1775 and going all the way to 1991. There is a gap in which they don't have any wars, and then they go on to the global war on terror, which started in October 2001 and is still ongoing. Could you advance the slide really quick? And so I'd like you to focus on this specifically. So from 1775 to 1991, in battle, there are over 651 women and men who have been lost on the battlefield. And I just want you to sit with that massive number for just a moment. 651,000. And it's not just the individuals who are lost, it is the families that are left behind. Massive, massive number. Could you go to the next slide? This number, 374,000. Next slide, please. Or should I say greater than 374,000? Go to the next slide, please. In just under a year. That is the number of lives that we have lost to COVID-19. Just let that sink in for a second. From 1775 to 1991, in all of the wars that the United States has fought in, we have tallied up the gargantuan number of over 641,000 lives lost over the course of a few centuries. But in under a year, COVID-19 has already tallied up half of that. I just wanted to provide a little context for what we're dealing with here. Could you go to the next slide for me, Will? So here it is. SARS-CoV-2, the virus responsible for COVID-19. I just want to lay out some differences here in nomenclature because it gets to be a little bit confusing at times. SARS-CoV-2 is the name of the virus that causes the disease COVID-19. Those terms are used interchangeably, but they are different. And it's important to know the difference when hearing people talk about the vaccine, which I will get to a little bit later. Now, this is a very interesting virus, and understanding a little bit about it to provide a little bit of context will highlight the importance of dealing with it. This virus is part of a family of viruses known as coronaviruses, oftentimes found in bats. Right now, there are a lot of coronaviruses in bats right now, many of which are currently capable of jumping into humans if given the opportunity. We've had a few over the past years, many of which cause mild symptoms responsible for colds. 3, however, have been public health emergencies: SARS, MERS, and now SARS-CoV-2. It's really important because our ability to deal with the current pandemic is going to be critical with whether or not we will be able to deal with the next coronavirus pandemic. And it will happen. And there's no way to predict whether or not the next coronavirus pandemic will be worse. If whether or not that virus will be more contagious and more lethal, more dangerous. So we have to get our collective act together right now. Now, if you get this, there is a chance that you'll be just fine. But let me just tell you a little bit about what you could experience. This virus is able to be transmitted through aerosolized droplets produced through talking, breathing, which is why distance and wearing a mask is so important. Say, for instance, you come into contact with someone who harbors the virus SARS-CoV-2, who is positive. They may or may not know it, but you come into contact with them and say, December 2020. Right? I think that's a good time period because I know many people may have gathered together for Christmas against advice from public health officials. So I want to pick December because I think that's an important time. You come into contact December 2020. You may expect, if symptoms become apparent, around 7 days. 3 days from that, if symptoms continue to progress, you may find yourself admitted into a hospital. That'll land you around January 10th. 5 days from there, the disease may progress. Now, there's only about a 21% chance that happens once that you're in the hospital, but you may find yourself in that 21%. 2 days from there, it progresses, and you can find yourself in the ICU. From there, all the way to February 10th, your situation becomes more and more dire, and you find it very difficult to breathe. Hopefully you recover. But many people do not. Again, over 300,000 have not. And by February 28th, you could be dead. I just want that to sink in because this is very serious, and hopefully I made the severity of the situation quite clear. Broken up in stages. Stage 1, the early infection, viral response phase, in which symptoms of the upper respiratory tract begin to dominate. Stage 2, the pulmonary phase, when the patient develops full-blown pneumonia with all of its associated symptoms. Then stage 3, that's the hyperinflammation stage, when patients develop acute respiratory distress syndrome, sepsis, kidney, and other organ failure. By this time, it is your own body that is beginning to tear itself apart, not the virus. But even though it seems that this situation is out of control, can we go to the next slide, Will? There is hope. There is a small sliver of hope. Yes, this is bad. In fact, it is the worst public health crisis that we have ever dealt with. You may try to compare it to things that you've experienced in the past, but please don't. It will mislead you. We've never dealt with anything like this ever before. The stability of our society depends on our ability to get this pandemic under control. And right now, it is not under control whatsoever, with massive flare-ups happening across the country. And as Will said, we lose thousands of people every single day. But this is a small sliver of hope, the vaccine. That is, right now, our only shot at pulling out of this. Can you go to the next slide? I have 3 individuals up here, all of which have made massive contributions to the world since the development of vaccines that changed the world forever. First, We have Edward Jenner. Edward Jenner is the individual who came up with the vaccine for smallpox, widely regarded as the worst pandemic or the worst infectious disease that the world has ever seen. Now, he accidentally stumbled across the vaccine by noticing that milkmaids somehow seemed immune to getting smallpox because they had come into experience with a similar virus while working with cows. He then hypothesized that if he could expose individuals to a similar virus, that they then would be protected from smallpox. He was right. Now, at that time, I'm sure he had his detractors. I'm sure he had people that asked him, how in the world could you protect someone from smallpox by exposing them to something from a cow? But unfortunately, the history books don't write about them. All we know is that this was our first vaccine. Next, Jonas Salk, the individual who found the vaccine that allowed us to deal with polio. Around the world, we have virtually eradicated polio, with the exception of a few communities in a few countries. But thanks to Jonas Salk, we were able to pull through a virus that was terrifying everyone. At that time, I'm sure there were detractors. I'm sure there were people who were apprehensive, who weren't quite sure, but the history books don't write about them. Now, next on the list is Dr. Kizzmekia Corbett, the lead scientist responsible for the research that paved the way for many of the vaccines that we are hopeful for now. She's credited with the Mrna vaccine and mRNA vaccine. Now, make no mistake, regardless of how you feel about her today, regardless of how you feel about the situation right now, she will go down in history along with the names of Edward Jenner, Jonas Salk. Right after that will be Kizzmekia Corbett. If it was up to me, she would definitely win the Nobel Prize. If it was up to me, she'd be the director of the NIH. That is how impactful her work is. I am a father. My wife and I, we talk often. What do we have to look forward to? The world is upside down. We don't know if this pandemic is going to be brought under control. But we knew that Dr. Corbett was working on this. And when it was made known that a vaccine was on the horizon, we began to be hopeful again about the future. And through her efforts and efforts of scientists like her, we have a chance, a fighting chance. But now the vaccine is created. Her work is done. It's now our job. We have to do what's responsible. We have to educate ourselves. We have to get vaccinated for ourselves, but not just for ourselves, but for our friends, our family members, for our entire country, for the future. This is the largest, most dangerous public health threat that our country has ever faced. Again, it is up to us. Will, can you go to the next slide, please? So here's a brief overview of how this RNA vaccine works. So we were able to look at the coronavirus. And Dr. Corbett and her team and other researchers were able to take a part of the genetics of the virus that was responsible for generating a protein known as the spike protein. They were then able to make a vaccine using just that information. They place it into your arm. Your body then recognizes that spike protein and then mounts an immune response against it. So that when you do come into contact with the virus in the future, your body is ready, it's prepared. And that preparation prevents the onset of severe disease or COVID. It is up to 95% effective. There are few things in the world that are 95% effective. And so much work has gone into this. Now, a lot of people may ask, what's in this vaccine? Is it natural? Well, what's in this vaccine is salt water, fat, and mRNA. That's it. The salt water is a physiological solution that is used very widely. The fat protects the mRNA because without that protection, the mRNA is rapidly destroyed. And it allows the mRNA to be utilized by the body. mRNA has no impact on your DNA whatsoever. mRNA is one of the most fundamental aspects of human biology. So if you're asking, is it natural? Should I take supplements? I would tell you that mRNA is more natural than any supplement that you can imagine. It is the basic building block for proteins. It's one of the most fundamental aspects, I repeat, of biology. So there it is. You take one dose, gets up to 50% protection from developing severe disease. You get the second dose between 21 and 28 days later, depending on which vaccine you take, and it bumps you up to 95% protection from severe disease. It is important that you do this. And it's still important that you still practice social distancing, wearing a mask, and washing your hand. Because you may not be developing symptoms. You may not have a progression towards disease, but you still may be capable of transmitting the disease to others who may not be vaccinated. So, two things. As soon as possible, get vaccinated. It is safe. It has been tested more rigorously than any vaccine to date, with thousands of people in vaccine trials, including Black people. Dr. Corbett made sure to that. And it is safe. And you have to weigh your options. On one hand, you can roll the dice, not get the vaccine, and keep your fingers crossed that you won't get sick, that you won't find yourself in a hospital bed with symptoms progressing, that you won't find yourself hooked up to a ventilator, that you won't find yourself telling your loved ones goodbye and I love you through the screen of a cell phone. People are skeptical, but to this date, I have not heard a single report of a skeptic who was hooked up to a ventilator. I hope I said that clear. You have a responsibility to yourself, your loved ones, and your community. This is safe, and I encourage you to take it. I know as soon as possible, Everyone in my family will be taking this vaccine. I would have taken it already if the phase of vaccination I qualified for was up, but I will wait my turn in line. And as soon as I possibly can take it, I will take it. My wife will take it. Can you go on to the next slide, please? Currently, North Carolina is under phase 1A. Now, this is where I admit things get a bit complicated because different phases can be moved through at different locations. But as a state, North Carolina is under phase 1A, and there will be a follow-up presentation in which we'll go through distribution in greater detail. But I just wanted to touch on it a little bit. Phase 1A, healthcare workers fighting COVID-19 and long-term care, staff and residents. Phase 1B, adults 75 years or older, and frontline essential workers. Phase 2, adults at high risk for exposure and increased risk of severe illness. Phase 3, students. Phase 4, everyone else, everyone who wants a safe and effective COVID-19 vaccination. All this information can be found in North Carolina Department of Health and Human Services. If you have the ability to visit the website, I urge you to stay abreast of all of the latest information as North Carolina progresses through the phases. The phase in vaccine distribution is liable to change. It's not guaranteed, but it may change as different policies and protocols are put into place or as different vaccines become available. So make sure you stay informed. I will be doing everything that I can with my colleagues to make sure you are informed. But most importantly, when it's your shot, make sure you take your shot. Make sure you get both. The first dose, 50% protection from severe disease. Second dose, 21 to 28 days later, 95% protection from the development of COVID. And remember, SARS-CoV-2 is the name of the virus. COVID is the name of the disease. Well, William, I'm happy to answer any questions that you may have. Thank you so much for your time. And hopefully I provided you all with useful information and with the courage to do what's right. Thank you.
You're on mute, Will.
All right. Can you all hear me? Am I unmuted now?
Yes.
Great. Thank you. Dr. Watkins, thank you for such an incredibly informative, emotional, and just an amazing presentation. Thank you so much for that information. There will be a recording of a couple questions in the chat I want to get to right away. There will be a recording made available. It will be on our YouTube channel, and we will certainly follow up with more information where you can see a replay of Dr. Watkins' presentation. As promised, we will move into our question and answer. What you see on the screen now is a map of cases per 100,000 for counties in North Carolina. And so what we're looking at is the increase of cases per 100,000 from before Thanksgiving around the 17th of November to last week. DHHS released numbers on the 6th, which sort of brought us to where we are today. And what we're seeing with the counties in orange and the darker orange are cases per 100,000, basically cases or number of cases, per capita that are just skyrocketing and they're moving really, really quickly. And so we look. I live in southeastern North Carolina, so my neighboring counties are Scotland, Robeson, and Bladen County, and so certainly those places are getting hammered. You see in the northeastern part of the state where they're getting hammered as well. So a vaccine is incredibly important. Again, it is our best shot at pulling out of this. And so without further ado, I'm going to stop my screen share here, and we're going to go ahead and get into some of these questions for you, Dr. Watkins. And I will ask this one from the Chapel Hill Carborough NAACP, and I think you answered this already, and we'll just repeat it again. What is in the vaccine, and is there anything harmful? And I love your explanation of that, but yeah, if you could just repeat it, it'd be great for our audience.
No, there's nothing harmful in these vaccines. They are comprised of three components: salt water, fat, and mRNA.
Thank you so much. Next question. This is also coming from the Chapel Hill Carborough NAACP, and this is a question about mRNA. How are they able to make the vaccine so quickly, warp speed?
Yeah, and I don't mean to answer this flippantly, but we're a lot smarter than we used to be. It's easier to see it in other situations, right?
Mm-hmm.
We are just having a conference call right now on your computer.
Mm-hmm.
That wouldn't have been possible 30 years ago.
That's right.
Well, think about your cell phone, right? Because of COVID, we're not able to go to the movie theaters, but I can stream everything I want on my television. I can think of something to order, pick up my phone, order it, and it'll be at my doorstep the next day. Or my car, I'll park it somewhere, I'll get inside, and my phone will tell me where my car is. These advancements are happening everywhere around us, including vaccines. We're just better. Dr. Corbett is better than Jonas Salk. Jonas Salk is better than Edward Jenner. That's just how it goes. We learn more and we get better. And I will say this, mRNA allows you to move a lot faster.
Mm-hmm.
That's really the magic of it, right?
Mm-hmm.
You start with mRNA, and then your body does all the work it would naturally do. Previously, you would have to make the protein, and that made the process a lot longer. So we're just better. We're just smarter than we were. I mean, we oftentimes hear about the 1918 H1N1 pandemic. We didn't even know what a virus was then. Now look how far we've come. Science has developed exponentially. So the answer to your question is we're just smarter.
Yeah, thank you for that. And I think that's a very important thing to consider. From the North Carolina Policy Watch, is the vaccine considered natural? What is the difference between the vaccine and natural home remedies such as mushrooms, elderberry, thieves oil, garlic, zinc, vitamin C, and vitamin D?
Yeah, it is considered natural. All of these things may be important to nutrition. And I will state that nutrition, proper diet, exercise, and just being in overall good health is good for your immune system. But nothing is better at dealing with a pandemic than a vaccine. It doesn't even come close. But they're all natural. I mean, a mushroom, you just eat a mushroom. The mushroom itself makes proteins. You know, that's a basic concept of biology. We just start with mRNA. So it's just as natural as those things, but I would say mRNA is just more fundamental and less complex than all of those things that you just mentioned. So to go back to your original question, is it natural? Absolutely. It is one of the most fundamental aspects of all biology, and that's mRNA.
Absolutely. Thank you. From Mr. Thomas Alston, what vaccines are available right now? Will I be able to select the vaccine I prefer?
Right now, I think under emergency use authorization, we have the Pfizer vaccine and the Mrna vaccine available to be used. From my understanding, on the horizon are the Johnson & Johnson and AstraZeneca vaccine. But currently, our vaccines that are available to us are the Pfizer vaccine and the Mrna vaccine. The Pfizer vaccine was first and the Mrna vaccine was second. And they're all comparable. But from my understanding right now, you don't have the opportunity to choose, but that has a lot to do with the availability. We don't have a lot available. We don't have, the ability to just choose because, there's a scarcity of these vaccines right now. So we're trying to figure out exactly how to do it. But until vaccines become more widely available, right now, I'm not sure if you have a choice on which one you can take.
Gotcha. From the Coalition for Healthcare of NC, is there reason to think that mRNA vaccines may differ from more traditional vaccines in that way?
So if I understand your question, are mRNA vaccines different than traditional vaccines?
Yes. Mm-hmm.
Yes, they are. They are different than traditional vaccines. One, mRNA vaccines can be made a lot quicker, right? Because you're getting your body to do what it already does. And so your body makes the protein rather than a protein being manufactured and then being introduced to your body to mount an immune response. But the mounting of an immune response, that's still the basic concept of a vaccine. You give your ability, you give your body an ability to get a head start. So this is a fundamental concept that I want to make clear. And this is why vaccines are so important. When you are exposed to a virus such as SARS-CoV-2, your immune system is constantly playing a game of catch up.
Mm-hmm.
And there's an opportunity that it lose that game of catch up. What a vaccine allows you to do is get a head start, to be prepared. So when you do come into contact with the virus, you have everything you need. And that's just the fundamental concept of a vaccine, is being ready and being prepared when you see the virus, so you don't have to play a dangerous and potentially deadly game of catch up. And hopefully I answered that question.
Yeah, I thought it was great. From the Chapel Hill Carrboro NAACP again, what are the possible side effects from the vaccine?
Right. So your immune system responds, and sometimes that response may be soreness, maybe other symptoms, but that is just a symptom of your immune system ramping up. Sometimes it doesn't make you feel that good. Now that's your immune system, and it does that all the time when you come into contact with something. When it revs up, sometimes it makes you feel not so good. That is a potential side effect. Soreness around the injection site, all these things are very, very normal. When this vaccine was being rolled out, again, thousands and thousands of people have, been enrolled in trials looking at the safety and efficacy of this vaccine. And when scientists look back, they look back at all the vaccines that we've ever used. And they established that most vaccine side effects occur within the first 2 months. And so that made sure that all the vaccine trials at least had 2 months before, it was even able to be approved. So that was taken care of. And, the long-term effect, I hope, is a long-term memory of that vaccination, right? That's the hope, but there's a chance that wanes. So we don't know, obviously, the long-term side effects, if any. I mean, I doubt that there's going to be any at all. But you have to weigh that up against the long-term side effects of, getting COVID, right? And that's what you just really have to weigh that up against, right? So, I don't know what the long-term side effects of, losing 300,000 people are, right? I don't know what the long-term side effects of a society of losing 3,000, 4,000 people a day. And so I think that's what you're going to have to weigh, right? It's like a cost benefit analysis, that the side effects are very, very few, if any, from taking the vaccine. Keep in mind, you're just being injected with saltwater fat and mRNA, right? And any side effect that you may see is just an immunological side effect oftentimes. It has nothing to do with mRNA, which I again say is present everywhere. You have mRNA all the time in your body. That just happens. But what I would like people to think about is, instead of kind of focusing on potential side effects, and again, this vaccine has been studied and has gone through a more rigorous, right, more rigorous testing and trials than almost anything that you may come into contact with that you may just take for granted, right? Um, but on the other hand, really think about what you're up against. You're up against 3,000 deaths a day. And you'll have to make that decision. And now, I will say that it's your choice at this point. Under emergency use authorization, these vaccines cannot be mandated at this time. So it is your choice at this point whether you want to go with a vaccine that is shown to be 95% effective at protecting you, that has been tested and studied more rigorously than anything else, or do you want to roll the dice and go with something known to kill 3,000 people a day? I mean, that's really what you're going to have to really think about, right? On one hand, you got something capable of killing, not capable, it kills 3,000 people a day. And on the other hand, you've got something that is safe, it can protect you, and it has been rigorously studied. But to answer your question specifically, though, I don't want to shy away from this. You know, we haven't had anybody who has been vaccinated and we look at them years out, right? But we do have vaccines that we have used several times over. And if there is an appearance of any side effects, it's within 2 months. And so that's why the trials that we've had at least went through 2 months.
Thank you for that. Marilyn Clayton asked, can cancer patients such as myself who are taking maintenance chemo expect the vaccine to function appropriately in their bodies? My oncologist told me that there is no data on a vaccine with cancer patients.
Right. So under, the guidance specifically of Anthony Fauci and other healthcare leaders, it is advised that individuals, even with autoimmune disorders or disorders in which the immune system is dampened, in which somebody is going chemotherapy or cancer, receive the vaccine. But it is very important that you work hand in hand with your healthcare providers and make sure that when you are getting you are getting the vaccine, everybody is aware of any pre-existing conditions that you may have. And that leads me to a next thing that you should make people aware of, allergic reactions, allergies, or so on and so forth. Just make sure that people are aware of any major allergies that you may have before getting vaccinated. But at this point, everybody's encouraged to get vaccinated, even people who are pregnant. So hopefully I answered that question. And, I would encourage you also to visit the CDC or North Carolina Department of Health and Human Services for further information.
Absolutely. Thank you. Michelle Geathers Clark, President and CEO of the United Way of Greater Greensboro, asked, is this going to be an annual vaccination?
That's hard to predict. That's really, really hard to predict. So, we hope that we can get up to a year of protection. We don't necessarily know how long people will be protected for. And if it wanes, if we'll still have virus circulating in the community. So that's really, really difficult to determine whether or not this will be just a once and done, or this will be an annual, or this will be something that you have to repeat. So the answer to that question is, I don't know.
From the Coalition for Healthcare of NC again, can I still transmit COVID after having the recommended doses of the vaccine?
It is possible because keep in mind the 95% protection is for development of COVID or symptoms or disease progression. So you may still harbor the virus SARS-CoV-2 and be capable of transmitting it to other people who don't have the vaccine and who are not protected from developing severe disease.
Gotcha. But if I have the vaccine and you have the vaccine, it means it's even less of a chance of being able to transmit or receive it, correct?
Right. So I just want to go back. So if we both have the vaccine and say, for instance, you were infected, there is a chance that I could be infected by you.
Mm-hmm.
But since the vaccine is 95% protective against developing symptoms or developing disease, it wouldn't necessarily matter to me if I have
Right.
a virus because I'm protected.
Right.
So the vaccine protection is so the body is prepared for an infection.
Right.
Right? It's not like a shield around your body so the virus can't get to you. No, you still can become infected with the virus, but your body is now capable of fighting and defeating that virus before you feel any symptoms.
That's right.
To answer your question, there is a chance that people who are vaccinated can transmit the virus to others. The vaccine will protect individuals if you have taken both doses. It will protect you from developing those symptoms and disease. So did I answer that?
Absolutely. Thank you for clarifying that. I think it's very important information. From CMS Solidarity, what levels of community spread, in your opinion, should trigger districts to shifting to remote learning? Do you think infection can be reduced to zero within schools when community spread is significant, especially when contact tracing resources seem to be overwhelmed?
So right now, so this is outside of the scope of this presentation, but I will attempt to answer this, right? So it depends on who you ask, right? In my opinion, with something so infectious, with something that it takes up to 7 days to even see symptoms, right? And also considering how many moving parts our society has, it's going to be very difficult or impossible to reduce all infections to zero while at the same time going about life normally. And this is why we're in this situation now, right? Because, we cannot do the things that we need to do absent of a vaccine to stop the spread of this virus. This virus depends on us not altering our behavior that much. And it knows what we'll do. And keep in mind that the thing that makes it really, really difficult is the 7 days before the appearance of symptoms. You don't even know if you're infected, and you can potentially be infectious. And that is just people who will develop symptoms. There are other people who will never develop symptoms. And that's very, very, very difficult to deal with, because somebody can just appear fine, but they harbor the virus and they can transmit it to someone else. And this is just something that can be transmitted by just talking and breathing. So it's just very, very difficult. So is it possible to reduce everything to zero while going about life normally? I highly doubt that. In fact, I would just go out on a limb and just say outright no. You cannot just go about life normally and then reduce infections to zero. That's impossible in my opinion. And you might find somebody who would disagree with me, and that's fine. But there's absolutely no way you can go about life normally with something that can be transmitted by aerosolized particles just from talking or breathing and have infection rates down to zero. I think that's virtually impossible.
That's right. Kerry Gibson asks, can the COVID vaccine alter the body's DNA?
No, this is mRNA. mRNA has nothing to do with DNA. So to answer that question, the COVID vaccine, the Moderna and Pfizer, the ones available, the mRNA-based vaccine has absolutely nothing to do with DNA. And no, it cannot alter the body's DNA.
Again, Michelle Gillis Clark asked, do we have any information on the impact to puberty or fertility in young women related to the vaccine?
I don't know that information. That is a good question. I don't know that information. And so I'm not going to attempt to provide you with any misleading guesses. I'm maybe there's information out there. I'm unaware of it. So just to answer that question is I don't know.
Okay. We will continue to answer questions on our Health Action NC social media site. We're coming up on the hour, and so I just want to give Dr. Watkins an opportunity to offer any last comments. Again, please continue to send your information or your questions to the email address so that we can follow up. And again, there will be a follow-up webinar around distribution. But Dr. Watkins, I want to give you the floor from one Bronco to another. I want to give you the floor to be able to sort of just close it out if you'd like.
You know, I mean, I will close it out with something else, but since you said Bronco, I have to say attitude check.
Bronco pride.
All right. But what I will say is that, you know, the vaccine is not our only hope. The fact that we're having this town hall and that there are people on it, that provides me with a lot of hope. And if I, at any moment, made you feel that it was somehow your fault for being suspicious or skeptical, allow me now to apologize. I am your servant. I work for you. The scientific community, if you are skeptical or if you are unsure, that is our responsibility. That is our fault. You have every right to be suspicious. You have every right to be skeptical. But when you are provided information, it's then your responsibility to change course and then disseminate that information to others. Provide other people with encouragement. When you get your vaccine, advertise it. Let people know. If you know what phase you're on and your neighbor doesn't know what phase you're on, let them know. We're all in it together. And like I said, I can never be lost in despair, because just being here with you right now provides me all the hope that one needs. I know that tomorrow will be bright. Yes, we have a rocky road ahead, but I have hope because I have you all. Thank each and every one of you for being here. It is my honor and privilege to serve you. Ask me any questions. If I didn't answer any questions properly, please let me know. If there's questions that I didn't get to, I'll be happy to provide you with information. I know this is cliche. We're all in this together. And like I said, you all are the true reasons to be hopeful. And thank you, and have a good night.
Thank you again, Dr. Watkins, and from the North Carolina Justice Center, we thank all of you for joining us, and we will again get through this together. Thank you.